7:44 this morning. Speaking of morning sickness, it is a common side effect for pregnant women. But a recent study shows that more women are turning away from traditional methods to treat the symptoms and instead using marijuana. SLU Care OBGYN at SSM Health St. Mary's Hospital, Dr. Katherine Mathews. She joins us this morning to talk about this trend, and I've already kind of been talking your ear about this because I didn't realize that this could be true. Mothers actually turning to marijuana to treat morning sickness. Is there a concern for the baby, or is that just not a thought? Where are their heads at?
I guess to start with, morning sickness is awful.
Awful.
It can be debilitating. It can make it hard for people to eat much of anything in the beginning of pregnancy. So I have great compassion for how terrible somebody can feel at the beginning with morning sickness.
Absolutely, and I will say that as a disclaimer as well.
Yes.
I haven't gone through it yet, but friends and family members and don't want to be there
terrible.
myself. Exactly.
Right. So I do have patients who are using marijuana, and I think it's for a mix of reasons. I think there is this notion that it's safe because in this state it's becoming legal medically. But honestly, we don't know. We haven't been able to study marijuana well because of how the government classifies it. And I think we have a number of concerns about harm. In addition to that, we do have treatments that are helpful for morning sickness, and we can scale those up if someone's really having trouble with that condition.
Right, because, I mean, while this study shows that marijuana use has actually doubled in U.S. pregnant women to 1 in 14, I mean, that's a big number. But you, like you said, you have no statistics, no research on exactly what those effects are on the baby.
Right, and our official position in OBGYN is no, don't smoke.
Right.
The problem is when somebody's having terrible sickness or bad anxiety or they've been using it for a long time, me saying don't smoke doesn't solve her problem.
Absolutely, because like you said, I mean, the truth of the matter is that morning sickness typically isn't just in the morning. It can be all day, and a lot of times we've heard stories about women being hospitalized because it can be so bad. Tell us about some of the other options that you would recommend. I know there have been times where you haven't even wanted to resort to medication because you worry about the health of the baby, but there are some safe options now.
Right. So there are a couple medications we use early in pregnancy. Vitamin B6 is helpful. There's another medication that I use a lot called metoclopramide. So it's a prescription medication that she takes before meals. Ginger can be helpful as well. There's some research, according to the OBGYN Society, that if you're taking prenatal vitamins before you get pregnant, that you can reduce the nausea and vomiting. And then for someone who has persistent nausea and vomiting after the first trimester, we can resort to some stronger medications that are typically used for severe cases of nausea and vomiting, like for cancer patients.
Absolutely. Well, it's a personal journey, that's for sure. And if that is the position that you're in, dealing with morning sickness, my heart goes out to these women. It's tough.
Yes, it really is.
Dr. Mathews, thanks so much for joining us here this morning. And John, we're going to send it back over to you.